welcome you here to Columbia Square, where our office has been since we built the building 30 years ago. So it's 30 years young this month, which is kind of interesting. As Mary likes to say, this afternoon we have something to talk about. My first and most important announcement is don't forget to get your parking validated. And there is the stand up there. Okay. So before you leave, if you're in the neighborhood, we can take care of that for you. So this is the first in a series of events like this that we hope will help you get a better understanding of how LifeWorks programs impact the real world. We like to talk most of the time about individuals and programs, which is very, very important. The thought process here is to take a broader point of view and tell you what it does really for society, for the economy, for a number of other reasons. So this is just the first in that process, and the thought process is that, again, that we will do probably on a quarterly basis. So thanks for taking the time to be here with us today. We really appreciate your time. I wanted to acknowledge and thank Steve Clark and Hamplin Community Newspapers for their support and sponsorship of the series. Steve isn't here yet, but we've got a few stragglers. But it's cold out there. They probably didn't want to walk for a couple blocks. Today's program is planned for a little under an hour. And again, we want to make sure that you're out of here a little bit before 1 o'clock. I'm going to be introducing Mary Monett, the LifeWorks CEO and President, who's going to present to you the LifeWorks vision. Mary will then introduce our State Attorney General, John Kroger, and John is planning on leaving plenty of time at the end of his presentation to answer questions. And just before we close, I'll remind you again to get your parking stamp and talk a little bit about future programs. So it's my pleasure to introduce Mary Monett. She's been President and CEO since 1998. I went over my notes with her 2 minutes ago. I had 78. That would have been tough. She honestly is one of the best managers I've ever seen. LifeWorks has consistently met or exceeded its goals and is at the top of the list when you look at reserves relative to revenue in the mental health and addiction industry. She is very much respected, and under her leadership, LifeWorks has grown to manage over 25 different programs in 3 counties with a total revenue in excess of $30 million. And I asked her just before I came up here, and when she started in 1998, the budget was about $6 million. So that's quite a bit of growth. So help me welcome Mary.
Thank you, Scott, and thanks everybody for coming on a Monday. We realized who plans events on Monday, so you get extra credit for that, especially on a cold Monday. Quickly, I just wanted, for those who don't know much about LifeWorks, I think many of you do, which is great, since we see lots of friends here. But just in terms of what we do, we're a mental health and addiction service agency that we serve now about 15,000 members of our community each year. And we do that, actually, I can update, we now are in 4 counties. So as of January 1st, we were founded in Washington County, and our founder, Dr. Ralph Croshaw, is here. And we're in Multnomah County, Clatsop County, and starting January 1st, we're going to open a site in Clackamas County. So really what we do at LifeWorks in terms of our mission is really to promote the health of the community by offering community-based services for mental health and addiction. When the founder and his good supporter, Jack Murdoch, gave the initial seed money, he was CEO of Tectonics, to form LifeWorks almost 50 years ago, it was really to say, we don't want to put people away in institutions, in particular with young children at that point. They wanted to see community-based solutions to keep families together in the community. And really our mission and our vision hasn't changed much since then. Even though 50 years later, we still believe the best alternative is to help people who struggle with these challenges to really get the services they need and be vital contributing members of the community. And we know with treatment and support that is possible. So we continue to work on that every day. I think what led us to today's conversation, we hope it can be a bit of a conversation, is, as you know, you just pick up the newspaper and we're just every day almost assaulted with the results of these issues when they're not treated in terms of community violence. I know there's some justice people that are, these issues, mental health and addiction, when not treated, they trouble all of us in our businesses and our communities. So we also really know that part of the stigma of the addiction and mental illness is what gets in the way of kind of conversations. So our hope is to take to just get us, I hope, to start some more discussion about how can we effectively work as a community to keep these issues being treated and moving forward for the health of the overall community. So you're a group of leaders and community people who we just value highly for being here and being part of willingness to sort of engage in the conversation. So with that, I have the pleasure to introduce our speaker. And I've actually had the chance to hear John Kroger speak 2 or 3 times, and he never disappoints. John is, I'm not going to read your whole bio. I hope that's okay.
I hope
But what I will say, what impresses me about John is that I don't know when you sleep or eat. So I think we covered the eating right there. But literally, he is an amazing man in terms of his past experience, both in law, but in leadership here in Oregon around these issues. So with that, I will turn this over, and then we're going to have time for questions, and we really invite you to participate. Thank you so much.
Well, thanks for being here today. What I'm going to do is talk for 10 or 15 minutes and then save most of the time that we've got for questions. What I want to do is talk a little bit about why substance abuse treatment and prevention matters to us in the community and why you should care a lot about it. And then we'll move from there to some of the specific things that we need to do in the state to improve the system that we have. I think the simplest way to start is to tell you that if you work in the criminal justice system, and that's what I used to do as a prosecutor, you see that almost the whole thing is driven by substance abuse. It is remarkable, the huge volume of your cases that are at root a case about an addict or a case about an alcoholic. Just to give you some numbers, in most counties, property crime, for example, most counties, roughly 70% of the property crime that we have is people stealing to pay for an addiction. The numbers on child abuse are perhaps even more worrisome. Oregon has a serious child abuse problem. It's not something that lands in the press that often. It's not something people think that much about. But we have very high child abuse numbers, and they keep going up. Right now, for our reported child abuse, about 60% of those cases have an allegation of drug or alcohol abuse. For the really serious cases, the cases where we have to terminate a parent's rights and put a kid up for adoption because they've been abused or neglected so severely, right now it's running about 90% of those cases having a drug addict or an alcoholic in the household. What is the cumulative impact of this? Oregon got a child welfare report card grade, and our last grade was a D. And that should give you some sense when 70 to 90% of this is fueled by addiction. If you want to have less child abuse in our state, the simple thing you've got to do is have less addiction. It's not just a crime problem. This also has an enormous impact on economic productivity around the state. One problem, I've talked to a lot of people who run manufacturing companies, extraordinarily difficult to keep workers because of the prevalence of substance abuse in the state. One national grocery store chain was opening up a branch on the coast, and they had a very strict drug-free workplace policy, and thus gave drug screening tests to everyone who applied for a job. And they told me the situation was bad, and I guess that meant 30% of the people who failed. They had almost 90% of their applicant pool failed. The impact of this on our economy is also profound. I'll just give you one more example of the economic impact. One thing we've seen in rural Oregon is a huge amount of theft of agricultural equipment out of people's fields, simply to sell the stuff for its scrap value. It's gotten so bad that some farmers have been denied insurance coverage for cultivators, for irrigation equipment, because they can't put a guard on the stuff 24/7. If they put it in the fields, it's going to be gone. When you start talking to someone who's running a multi-million-dollar agricultural business about not being able to insure any of the basic equipment they use, you're talking about a profound impact on the way they do business. So it's a huge crime problem. It's a huge economic problem. I will tell you, very frankly, I believe very much in enforcement. I believe very much in enforcement. I think we ought to be going after people who import drugs and sell drugs. We ought to be putting them in jail. But the problem is, if you're just doing enforcement, and I think Oregon's doing a very fine job of enforcement, you're really fighting with one hand tied behind your back. And the reason for that is very simple, and it's one that I think people in the business community will understand perhaps better than anyone else in the state. Drugs are a commodity like any other commodity you've got. It's like sugar or coffee or oil. If you've got a very strong demand, someone is going to sell you that product. And you can see that from our own experience here in Oregon. A couple years ago, we put pseudoephedrine, the cold medicine, behind the counters at pharmacies. Very good idea on its own. We've used pseudoephedrine is the basic component for home cooking of methamphetamine. And we've seen an enormous drop in the number of meth houses locally in the state. So, I mean, different people have cited different numbers, but it's a 90 or 95% drop statewide in the number of meth houses that we're busting. And that's great. You know, that's fewer kids exposed to the stuff. It's fewer houses that, you know, just to detoxify a meth production site is an immense undertaking for a community. Fewer than that, all that's great. Here's the problem. Because drugs are a commodity, if your demand is up here and you eliminate the local supply, all you have is a market opportunity. And that is what Oregon has done. You know, 5 years ago, we did not have significant Mexico-based drug cartels bringing a lot of drugs into the state. We had them, but the honest answer is that we were, you know, particularly with meth, producing everything locally. Now that's completely changed. About 90% of our meth is now imported. We've essentially outsourced production from Oregon to Mexico. And the last DEA study had Mexico-based drug cartels, big ones, sophisticated ones, operating in every major city in Oregon. If you just try to clamp down on the supply through enforcement, and you don't try to drop the demand, you're not going to make any lasting progress. You can temporarily dislocate the market. You can drive up prices in the short term. You're not going to make any lasting impact. And we've seen that over and over. I'll give you one more fact. I'm going to use an antitrust term, forgive me. Meth is actually cross-elastic with cocaine, which means as meth prices go up and it's harder for people to buy, they'll buy more cocaine. And so one of the things we saw when meth prices went up, when we temporarily dislocated the meth market, is that we had an increase in the amount of cocaine that was being used in the state. Again, it's just to show you this, you have to have a view of this that views it as a market. And you've got to tackle demand as well as supply. That's where drug treatment and prevention programs come in. Things like LifeWorks come in, because what they're trying to do is decrease the demand for drugs by decreasing the number of addicts we have. And the simple thing I will tell you is this stuff works. Most of the public doesn't think it works. If you look at polling data, most people are very skeptical about drug treatment. I think in part because everyone knows someone who's been in a 12-step program and relapsed. The truth is, it's extraordinarily cost effective. I'll give you one study. The RAND Corporation, which some of you know is a major independent think tank, did number crunching on the cost effectiveness of drug treatment as a strategy for reducing drug abuse. A couple comparisons. They compared it to the cost of the money we're spending in countries like Afghanistan and Colombia to limit drug production. They found it was 22 times more cost effective than trying to spend that money to reduce production overseas. Border interdiction, they found it was 11 times more cost effective than simply trying to reduce demand here. They found it was much more cost effective than street enforcement for reducing drug addiction. It is not a silver bullet. It's not like you run someone through a 30-day drug treatment program and boom, they're cured. It's really not like an acute illness at all. It's not like you go in and you get a tooth pulled. It is a chronic problem. And the results are often slow and cumulative. The truth is, often it takes 2 or 3 times running someone through a drug treatment program before the results stick. But the overall impact is enormous. Even when it only works temporarily, it has an enormous impact. One of the things that economists studying this problem have found is just getting hardcore addicts off drugs for a short period of time while they're in treatment, even if they relapse, has a huge benefit. And the reason for that is very simple. About 90% of the demand for drugs in the United States comes from 10% of the users. It's the hardcore addicts who really are the ones that drive the market. And if you can get them off drugs, even for a short period of time, it has a measurable impact. So, looking at this as a law enforcement person, as someone who wants to reduce crime and wants to do it in the most cost-effective manner possible, I can tell you that our strategy has to have really good drug treatment as well as enforcement. If we just do one, we're going to be failing. If we just do treatment and ignore enforcement, we're going to be overrun with drug traffickers. If we just do the enforcement and we don't do the drug treatment, we're not going to make any real lasting results. So, where are we as a state? I will tell you this. I think we have very good drug treatment programs that entities like LifeWorks are running. We've got a number that are very highly respected. This is certainly one of them. That's part of why I'm here. The challenge, though, we have is that the system as a whole does not work effectively. What's wrong with our system? I'll give you a couple examples. Part of it is that our state funding for treatment and prevention is on a roller coaster, like many other things in the state budget. And the challenge for a lot of entities because of that is profound. One of the things we don't have in the state is enough treatment capacity. We don't have enough beds. We can meet about a quarter of the demand for drug treatment in the state right now. And one of the reasons people like LifeWorks can't add capacity is because they can't reliably predict if there's going to be state-funded programs there or not, because they are on that roller coaster. So stable funding is definitely a goal. But our challenges go well beyond that. One of the things that we are not doing is getting enough people into drug treatment before they're in the criminal justice system. We are doing an increasingly better job when we arrest people of getting them into drug treatment. If they're going to the state prisons, there's a higher percentage chance they'll go into drug treatment. If they are arrested for a drug crime or they're an addict committing a property crime, there's an increasing chance they'll get into something like a drug court that will help them. But where we're failing is trying to get help to people before they've gone out on a crime spree. Right now, around the state, we turn people away from drug treatment. That is just a reality. It's just a fact. Most people, overwhelmingly, who need drug treatment don't have health insurance that covers it. And they're just not the kind of people that have the kind of gold-plated insurance policy that would cover substance abuse. And they don't have any cash. They've spent their cash on drugs. And so, they're going to wind up going to a program, and it's going to be limited by the capacity of charitable dollars and state dollars. And so, right now, we are turning people away. We're turning parents away from drug treatment, which is a remarkable fact. I met a woman the other day who had gone and tried to get into drug treatment at age 17. This is down in the Willamette Valley. Had been turned away because they didn't have any access. They didn't have any access at that time. For the next 12 years, just a horrible tale. Repeatedly committing crimes herself, repeatedly a victim of sexual assault and rape from her partner and other people who are addicts. Wound up having 2 unwanted pregnancies. Both of those kids are learning disabled because this person was using meth during the pregnancies. Both of those kids were abused and neglected. Both of them are in foster care. Both of them will never be fully functioning, successful adults because of the damage that was done to them during her pregnancy. All those costs could have been avoided if you could have gotten help to this person up front. And what I loved about that case is they had documented her going in and trying to get help and getting turned away. And she's finally turned her life around, but boy, you think about how much cheaper it would have been to provide the help up front than go through 12 years of all the costs associated with her crime and all of the decades that we're going to be paying because her children are never going to be fully functioning, successful human beings. A third problem, it's not just funding, it's not just that we don't have enough access. We are not collecting the results from all the different programs in ways that really let you see whether you're having a measurable impact or not. It's very, our system of tracking results and collecting data is extraordinarily disorganized. Some people aren't tracking results at all. I will just pass on a conversation I had with one treatment facility. This is a program, it's not LifeWorks, but with a very good reputation, very well-meaning people. I mean, I'm sure their program is doing good. What I asked, though, is can you prove that this is working? And they said, well, we're not required to collect data about results as part of our state contract. And I said, well, are you collecting results anyways? And they said, no, because that costs money and we don't get it as part of the state contract, so we have to choose. Are we going to provide more services or are we going to track the results? And so we provide more services. And I asked the person I was meeting with, you know, I said kind of apologetically, I know you think this is working, but why are you confident that this is working? How do you know? And she said, well, we're throwing money out there and we're hoping. And that is not going to cut it. I mean, part of our biggest challenge is a political challenge of convincing taxpayers that this stuff really works. And if you can't prove it works, it's going to be very difficult to have that conversation. Other programs are collecting data. The problem is they're collecting too much data. Every different government entity asks for different data to be collected in different ways. So we have some organizations that are collecting 5 different sets. The Oregon Youth Authority asks them to collect one set of data. The county government sets another. The Department of Corrections a third. They wind up collecting all these different data sets. And what we're left with is all these numbers, none of which you can compare to anything else. It's like apples to oranges comparisons. We can't pick which programs are really working versus which ones aren't. We can't identify which strategies are really paying off and which ones are not. So the data collection has to be fixed. Add all these things together, what do you get? The federal government ranks the 50 states on the quality of their drug treatment program. And we are always in the bottom quarter or bottom third. We are never higher than that. And in some areas, our performance is truly abysmal. When you look at the real gaps in our system, services to teenagers and young adults is probably the most glaring one in Oregon. A couple years ago, we were 49th in the nation in terms of getting treatment to young adults. And, you know, that there are many areas in which we're failing our kids, but that is certainly one of them. You can see the impact of that on the ground. I mean, to say we're 49th in the nation is just a number. You can see the impact on the ground. I was at a place called the DePaul Youth Treatment Center, which some of you are probably familiar with. It's a residential treatment center for teenagers, so the kids that are 14, 15, 16 years old. And boy, if you haven't gone to a place like that, I strongly recommend that you do. For me, it was extraordinarily powerful. You know, I've worked in criminal justice, but really never, I just did cases involving adults and never done stuff in juvenile courts. You ask, okay, who's the 14-year-old meth addict who's there getting help? The statistics were just unbelievable. About 90% of the girls that were there had been sexually abused, either by parents who were drug addicts or by drug addicts coming to use drugs with their parents. The abuse rate for boys was almost as high as 70%. Totally stunning to walk through this place. It's the first safe place these kids have ever had to go to bed at night safely and to get up in the morning and to go to school and to get help for their addiction. And, you know, if you haven't lived that life, I mean, it's almost unimaginable. Their lives have been hell up to this point. There's no other word for it. When we're walking around the program, it made me cry. It was that powerful. You could sense the relief on the kids' faces. I mean, it's just remarkable. I asked the executive director who was walking me around how often they had to turn kids away because they didn't have the funding, and so they have kids who want to be there and need to be there and they have to say no. And the answer was all the time. And that's what the reality of what we've got going is. So how do we fix this thing? I think there are three things that are critical to our strategy. One of them is out of our control, but it's potentially the single thing that's most transformative. And that is the potential passage of the National Healthcare Reform Bill. Now, here's the thing. I have no idea whether the people in this room support it or oppose it. Some of you probably support it. Some of you probably oppose it. I will simply tell you this. Whatever else you think about the bill, the one thing that's really important is in its basic insurance coverage package, it has substance abuse treatment in that basic package. And that's overdue. I mean, if you think about the healthcare system really trying to protect the wellness of the people in it, you are not going to be a thriving human being if you've got an alcohol or drug abuse problem. I mean, there's nothing more important. You know, it's more important to fix than high blood pressure. It is, you know. But for us, it's also potentially transformative. I mean, if that passes, that will mean that people will have the ability to pay for treatment that currently have no ability to do it. That will take off some of the strain on state government. It will take off some of the strain on the charitable dollars that organizations have to raise. It is truly a game changer. If I could pick one thing in the criminal justice area that would happen in the United States to reduce crime, that's the single biggest thing I would pick. I think the second thing we have to do is we really have to fix the state programs. And again, it's not the individual service providers like LifeWorks that are the problem. It's the system that we've got, which is roller coaster funding, no coherent set of accountability, a huge number of gaps in service for things like kids. In this last legislative session, I went to the legislature and got them to approve a multi-year process of overhauling our drug treatment and prevention programs. And they did so. So we now have a state drug and alcohol policy commission. Mary Ellen Glenn, who's here today, is the executive director. And what we did is brought all the stakeholders together that normally fight against each other, quite honestly. We've got people in state government and county government who don't always get along. We've got the treatment community and the law enforcement community who often are viewed as competing for dollars. We have everyone around the table, business community, treatment experts, treatment providers, and we are all working together to try to design what we think will be a truly world-class treatment and prevention program for Oregon. The first goal is not to radically increase the amount of funding. I have to tell you that. What we need to do first is get the structures in place to spend every dime we've got wisely. So right now we're working on the data collection piece. We're working on prevention. Prevention programs are radically underfunded in Oregon. And a lot of them that do exist don't really reflect all of the research that's been done over the last 10 or 15 years. There's been a revolution in prevention programs for schools. So much so, the National Academy of Science put out a report earlier this year. You know, the National Academy of Science, like real scientists, they always hedge. You know, they always say, well, the data, blah, blah, blah. No, no, no. This thing says, because of the research we've done over the last 20 years, we now know how to prevent the overwhelming majority of bad behavior, if you will, by children and teenagers. Because the peer-reviewed research that we've done is so positive in terms of the kinds of things you can do in school to keep kids on the straight path. So what we're doing is very simple. We're going to try to rebuild the thing from the ground up. We're going to try to get more people into drug treatment before they're in the criminal justice system. When we do have to arrest them, and frankly there's some people we're never going to get into treatment unless we do. When we do arrest those people, we got to make sure that the treatment is available and the transitional services are there for when they get out. It's not enough to put them in prison when put them in treatment when they're in prison, then just put them back in their old neighborhoods. You've got to have transitional services. We've got to have that data accountability piece, and we've got to have real prevention programs that are adequately funded and that reflect the best science. So all of that is underway now in state government. We're going to have a package of proposals for the legislature in 2011. I guess the simple thing I would tell you is that this is not going to be easy. If this were easy to fix our system, we would have already done it. But if we do it properly, I think you'll see two things. One is you'll see less crime, and I believe that 100%. I mean, I just don't doubt that. If you can get more people into drug treatment, if you can get better prevention programs running around the state, you'll have less crime. The other thing you'll do is save money. And this is extraordinarily important when you're thinking about both what kind of programs you want at the state level, but also, quite frankly, where you put your charitable dollars. Every dollar that the Oregon state government puts into treatment and prevention programs right now saves about $7 in other programs. You have lower healthcare costs because you have fewer people going to emergency rooms. I was meeting with the CEO of a major hospital chain the other day, and I knew this was a problem, but it's astounding how much care that they are providing to people who have addiction problems showing up in emergency rooms. And this is all stuff that's ultimately passed on to us in our insurance rates. You'll have lower enforcement costs, and again, I believe that. I think if you've got fewer people out on the street committing crimes, you're going to ultimately have savings in public safety. You're going to have lower corrections costs, and perhaps most profoundly of all, your child welfare costs will go down. There's such a clear correlation between substance abuse and child abuse. All the dollars we're saving, I mean, just to give you one example, I have 50 attorneys who work on child abuse cases alone in our state. The costs are enormous, and you'll see substantial savings in those if you invest more in drug treatment and drug prevention. So I think those are two pillars. Hopefully we'll get some national health insurance that actually includes substance abuse. Hopefully this reform process at the state level, both with greater access and greater accountability, will work. I think the third thing, and it's the thing I'll close and then we can take questions, is that we need a lot more civic engagement with our providers, entities like LifeWorks. And the reality is, in the short term, state funding is not going to radically increase. I mean, that is just the reality. I would love to see it increase over time, and I'm going to push for it to increase steadily over time. But as everyone knows, we have a really unstable revenue base in the state, and state government is more or less broke, and we're not going to see huge increases there. And so charitable dollars are going to have to do a lot more if entities like LifeWorks are going to make a real difference in terms of getting more people into treatment. We just can't do it without that. And the benefit is not just that they'll be able to make up for gaps in governmental funding. I think it's more profound than that. As you look at who's going to deliver services, eventually this country is going to have much deeper, much improved treatment services. I know that it's going to happen because it makes common sense, and the coalition behind this is very broad. Everyone recognizes we need to do this. The question is whether you're going to have most of the treatment being provided by governmental entities or nonprofit entities. And I have to tell you, I have a strong preference for nonprofit entities being the primary deliverers of that. As we think about what the delivery system is going to look like, government has a huge role to play in financing it, but I think we're going to be better off if we have we don't create a new giant bureaucracy in order to provide these services, but that we rely on nonprofit providers to continue to do the vast majority of the work. And that's not going to happen if those programs can't thrive. And so the last thing I think I would say to you is that I assume it's part of Scott's goal in increasing awareness amongst many people about what LifeWorks does. But civic engagement, not just with LifeWorks, but all of these treatment and prevention programs that are up and running is extraordinarily important. Everyone has causes that they care deeply about. This may not be one that you're familiar with, but I would hope after today you would think about greater involvement with it, because if it doesn't have support, particularly from the business community, these programs aren't going to thrive the way they should. So with that, I think I've talked your ear off probably enough. I'd love to just open it up for questions, and we can talk about whatever anyone would like to talk about. Yeah, Scott.
You're going to bring that bill to the legislature in 2011.
Yeah.
Let's think positive and say that the economy recovers in that kind of a scenario. How long do you think it would take to implement, the grand plan that you've got in mind?
My goal is slow but steady progress. I actually think sometimes we swing for the fences, we do things in a grand way, and then we don't really build both the financial structure but also the political foundation to make those programs successful in the long run. And the classic example is the Oregon Health Plan, which, we spent a lot of money creating this really innovative system, and then we basically defunded it all back to the point where it's in many ways a very standard state healthcare plan once again. And so my goal, rather than trying to do something remarkable in a 2-year period, is slow, steady progress. I honestly think of this as a 10-year thing. What I would like to see is us going from being in the bottom third or bottom quarter where we are today to 10 years from now being one of the best programs in the state and in the country. The things we can do immediately, the data collection piece drives me crazy. I mean, it's not that hard. And the states that really do this well, part of the reason they're able to get the funding to increase their treatment system is because they've got the data that shows it works. I mean, Washington has done this. Washington has invested the money to collect data so that they can go to the legislature every 2 years and they can say, look, here's what's working, keep funding this. This isn't working as well as we'd like. Why don't you cut the funding on this? And for every one of these programs, here's the exact amount of money you're saving for every dollar you invest. That kind of hard data, as opposed to estimates or these are the kind of results people get elsewhere in the country, that kind of hard data is incredibly valuable. And so one of the things we're focused on in the short term is making sure that we start collecting the data that lets us track results. And frankly, for the programs that really aren't tracking their data, it will really let us see if they're having the effect we want. For those that already are, it's going to save them money. To be honest, one of the things we've heard from a lot of people is, I'd rather be reporting one set of data than 5 different sets of data. And so we're going to, Ted Wheeler is the vice chair of this commission. I'm chairing it. Ted is laid up, so we won't expect much from him in the short term. But part of the reason that I asked Chairman Wheeler to be involved in this is because the rubber meets the road really at the county level for a lot of these treatment and prevention programs. And we need to make sure that the counties are on board and that we're all working together. So some of those things, the basic structure we can fix now. And then what you're going to see is slowly ramping up the funding as we show people that this works. The prevention programs, for example, we're really, no one knows really how much we're spending on prevention programs in the state, is the honest answer. No one really knows the number. It's at least $30 million, but it's probably much larger than that. We're trying to figure out what the state is currently spending on prevention because no one has that number. That's revealing in itself that no one really knows what the budget is. But I asked someone, okay, of the spending that we're doing, what percentage of that spending really reflects the best practices that are available? And of course, no one knows, but the ballpark figure I got was probably about 10%. And so, what we're really talking about is major changes in the way that we do things. And so, my goal is slow, steady progress. It's not to try to shoot up the lights in 1 year or 2 years, but for every 2-year period, we got our house in order in terms of having a unified single budget for all of this. We collect data so we can prioritize based on what's really working and what has the biggest cost benefit benefit, and we increase the funding up from there when we've shown that the system is working properly. Yes, sir.
Medical marijuana, do you think it has an impact on the problem? know that they're politically charged.
No, I'm actually thinking, because no one's really ever posed that question that way. I would say this, there is no doubt to me that as you're thinking about what drugs we need to be focusing on, the drugs we need to be focusing on are meth, cocaine, and heroin. I would add to that prescription drug abuse by kids and alcohol. When you compare something like meth to something like marijuana, I mean, it's just very clear whether you like marijuana or you don't. The social consequences of marijuana abuse are substantially reduced compared to something like meth or heroin. The medical marijuana program, I mean, the people in the state want it. I have to say, I mean, there are things about the system that we've got now that don't strike me as really what people thought they were getting when they voted for it. But I see that as sort of a separate question. I don't think ultimately that's driving our crime problem in a way that some of these other drugs are.
Well, there has to be a cost of running and regulating that program. So is that money well spent?
You know, that's something I haven't really thought about in those terms. I couldn't even tell you what the program costs. So that could be something to go look into.
So what steps are in addition to what is already being done to
Sure.
reduce the inventory of these drugs crossing our borders, coming across?
You know, I think the federal government is doing just about everything it can on border interdiction, and I think to put it simply, NAFTA makes this almost impossible. I mean that is the basic economic reality. When we pass NAFTA, the truck volume at the border crossings increased dramatically, and there is no way we can really inspect the overwhelming majority of vehicles coming through. I mean that is just the fact. If we did, they would back up to Guatemala, and I don't know that we have a solution for that. I mean, I think we're catching no one really has data, but I think we're catching a tiny percentage of the drugs that come across the border. There are real reasons to be concerned about border security, particularly I think from a terrorism point of view. That is for me an even bigger concern. But the thing I'm confident of is if you had $1 and you wanted to reduce the drug problem in the United States, if you had to choose between sticking it in drug treatment or putting it on border interdiction, I have no doubt it would be more effective to put it on reducing demand for drugs in the United States. One of the things we've seen, even when we have successes internationally on narcotics, the progress is very temporary. A couple examples: Turkey, major opium producer, we spent $1 billion, which back then was real money, in the 1970s, getting Turkey not to produce opium, and it succeeded. But because the demand was there, all the production moved primarily to Afghanistan. In Latin America, Peru was the major coca producer, not Colombia. We spent $1 gazillion trying to beat back the drug trade in Peru. All of it migrated across the border to Colombia. Thailand was basically weaned off opium production, which is a huge success. All of that moved to Myanmar in the Golden Triangle area. I mean, it's like squeezing a balloon. Even on our interdiction, we were actually in the 80s when we first started really doing interdiction, very successful in closing down a lot of the traffic which was coming into Florida. I mean, the South Florida used to be the primary landing point. Small planes and boats coming across the Caribbean. Huge, I mean, whatever, when we put AWACS planes and the Coast Guard to work, huge impact. But all the transportation just shifted to the Texas-Mexico border and the Arizona-Mexico border. So, having watched that for 30 years of data, you just realize if we don't reduce demand, we're not going to make any lasting progress. I mean, the international narcotics market is about a $450 billion market. I mean, it is not, we're talking, it is a huge market, and when you've got that much money involved, doing things to try to dislocate drug trafficking groups is going to be very temporary. I mean, Plan Colombia, which is the effort to get Colombian traffickers to produce less, you know, initially it was a lot of paramilitary raids on production facilities and a ton of eradication. We were spraying Roundup and other things on crops. There's so much money involved. It's not like these drug trafficking cartels are going to go away because we spray some stuff on their crops. I mean, what they did was move their production from giant flatland production areas to smaller parcels on hillsides, which are very hard to identify and spray. And they genetically, you know, they didn't genetically modify, but they crossbred different strains of coca to increase the potency level of every leaf, so they can get a much bigger yield out of a much smaller crop. All of that just goes to show that, you know, if we don't tackle demand, we're not going to get anywhere. The United States is really, I think policymakers have known this for 20 years, and we haven't done what we need to do, which is get more people into drug treatment and get better programs in schools that will keep kids away from this stuff. Yeah.
Perspective you provide as Attorney General is fantastic. What I'd like to know, because you've identified educational issues, health issues, mental health issues, law enforcement issues, how can we bring all those different perspectives together, not only at the state level, but at the community level, to be able to do what you're talking about? What do you see happening over the next couple of years to get the collaboration and the partnerships across the systems, both at the state level and the community level?
Well, I think the starting point for me is to get all of the government decisional makers at one table, and that's really what we've tried to do with this Drug and Alcohol Policy Commission. I'll give you an example. Right now, part of our treatment dollars go through the Department of Human Services and part go through the Department of Corrections, and those budgets aren't coordinated in any way. I mean, the heads of those two agencies go up in front of the legislature. They do everything they can to get money for their own budgets, and someone's a winner and someone's a loser, but there's really no discussion. You know, those two agencies' budgets are in different subcommittees of the Ways and Means Committee. There's really no discussion of, gee, what is our overall strategy and how much funding do we want to allocate to these various areas? So part of it is really, as a start, getting government on the same page. Chief, good to see you.
He's right, by the way.
Why don't you just quit now? So I think that's part of it. That's part of why we got the counties involved here. I mean, part of it is if state government decided to do some things and the counties weren't on the team, we really wouldn't make any real progress. At the community level, I think once we sort of straighten out get our government house in order, we're going to have an increasing engagement with the community. And I see that happening in a couple of different places. One of them is we're going to have to do a better job politically of explaining to voters why this stuff matters. If you look at polling data, people overwhelmingly believe that if you want to control drugs, enforcement is much more effective than treatment. And from a cost-effective point of view, that's just not true. But that data suggests that we need to do a much better job of explaining this to the public. And so one thing we're going to need is a lot of engagement between policymakers and community leaders with voters, because we're going to ultimately, eventually need more funding in this area. And we're ultimately going to have savings in other programs that can be used to fund this stuff, but you're going to have to make that initial investment first and let those savings play out over time. And so greater involvement to I'm sorry. It's amazing I have to run before. Yeah, that's my wife. No, I'll call her back. So that's part of it. I think part of that is sort of rebranding how we explain this to the public. I mean, I think one of the challenges we've had is traditionally, the traditional advocates of treatment programs were often also major critics of law enforcement. And their message was treatment, not enforcement. And when you start the message like that, first you lose a lot of voters just to begin with. But even more, you lose the entire law enforcement community. I mean, and the reason that's significant is because of another thing I'll tell you the polling data shows. The number one person that people trust about drug treatment is their county sheriff. And so if you don't have, it's not the Attorney General, I'm working on that, but that just shows if you don't, I mean, the number two was the district attorney. If you don't have law enforcement telling people that this stuff will cut crime and save you money, you're not going to get voter support for it. And so part of it is changing the way we describe it. Part of it goes back to collecting that data. It would be a lot easier to be able to come back and say to people, here's exactly what you're paying for. I mean, I think that's critical. Oregon right now is one of 5 states in the country that spends more in their general fund budget on corrections than we do on higher education. And you know, you ask yourself, okay, is that a good long-term strategy? No, it's disastrous. What do we do about that? I mean, one answer is you could immediately let everyone out of prison. And I just would suggest from a crime perspective, you would not like that result. The other thing that's really interesting about the data is it's not that we're actually spending too much on prisons. We're actually incarcerating below the national average in terms of the percentage of our citizens behind bars. What it shows is we've just dramatically underfunded higher education for 20 or 30 years. But it still is a very revealing fact. I mean, we want to be a state that is spending less on corrections and spending more on things like education. And how are we going to get there? The simple answer is if you have less crime, you'll spend less on corrections. And you know, we still have, particularly in property crime rates well above the national average. On some things like identity theft, we are off the charts. So, you know, I think an engagement with the public is critical. The other thing we're going to have, particularly in the prevention area, is a whole different conversation with communities. The prevention programs, I won't go into too much detail about what works and what doesn't, but the ones that are most successful are not ones where the government comes in and says, okay, here's the one-size-fits-all prevention program, we're footing the bill, now you do it. The ones that have been most productive are, first of all, when the government comes in with a menu of options. And we have, you know, there's 30 or 40 things that have proved to work. So we don't have to do a one-size-fits-all. We can go into a community and say, here's 30 or 40 things that we think work. You pick the one that you think will work. You know your local community better. I mean, God knows that what a tribe will pick for a reservation is probably going to be very different from what a suburban community will pick. I mean, so giving people greater choice and ownership over exactly what the program they're implementing, but making sure that whatever they choose is one that's been tested already to work. And second, the programs that work best are ones where the government doesn't pay for everything. The ones that work best are where the government comes in and saying, we'll stake you for part, and you're going to have to come up with the rest. Local businesses, PTA groups, nonprofits are going to have to come up with the rest to do this. And because that gives people a real ownership stake in the program, and that is a game changer. It's something, you know, frankly, you talked about, Scott, about the rate at which we roll this out. You know, we should start with people who are really willing. You know, we should start with school districts who are really eager for this. We don't need to force it on anyone. We're going to be starting relatively small, so we should pick the most willing customers. But that needs, for that to be successful, that's going to have to be a very different conversation, like we don't have at all right now between state government and a lot of communities. So that's how I see this playing out. And I obviously, and I know I've said this to you personally on several occasions now, but that's obviously going to require a lot of engagement and cooperation between government and nonprofit groups in the state.
Promised that you'd be out here close to 1, and it is. Thank you so much. As we talked about trying to do an event like this, which is not meant to be a fundraiser. It's just to raise the visibility of LifeWorks and again, kind of the impact of what we do. I suggested John because I met him before the primary last time, and he spoke so passionately about crime and taking care of people, and I proved to be correct. I think we could have spent another hour with him today. So thank you so much for being with us. I want to remind you to get your parking stamps. It was ironic that you brought up Ted, because Ted was going to be here today, and Ted actually said that he would be the next person to be the presenter at our next event. He's had to deal with the implosion of one of his major suppliers, Cascadia. He knew nothing about this business before that. He knows an awful lot about it now, and it was really be fascinating to hear what he has to say on the topic. So thanks a lot again for being here. I hope you've got an overcoat. Stay warm. And let's thank John one more time.
I just, in closing, also point out, you do have some data from LifeWorks in your packet about our outcomes. We take that seriously. And again, just thanks everybody. Have a great holiday season.
Do that.
Thank you.
Yeah.